Hi, I'm Cassidy and I'm a physical therapist with Total Performance Physical Therapy at our Norristown location. Today I'm going to be talking about how we can address stiffness in the neck, and this is primarily targeted to folks over the age of 55, maybe you're in your 60s or 70s, and you're noticing that you're having a lot of difficulty turning your head. Now, there's a couple causes of this. One is that there are some normal age-related changes that happen in the neck that can cause stiffness, but I always say I don't want to ever resign myself to something and just brush it off as age, because that's a little bit short-sighted and it's not really fair. Because if you look around at other people your age, they may be able to turn their head just fine. So here are some things that we can do to help with the stiffness of the neck. And if you're home, here are some things you can try. So one big thing that I see in folks who are having trouble turning their head is that the resting posture of the neck is a little bit forward, like this. So if you look at my whole neck here, this is the muscles of your neck. It's actually a bunch of bones stacked on each other. And when you turn your neck and you're upright, you can see everything's kind of turning together as I turn. But if I'm forward like this and I need to turn, I can't get as far. These bottom vertebrae are kind of not moving at all, right? And it's just this top one that's turning. And I can't get as far as when I'm up here. So one of the biggest things that we want to try to do is get you in more of this upright posture. So at PT, what that would look like is mobility exercises and strengthening to help you get up here, which would happen at your upper back, but then also exercises that look like this. So I'm sitting up tall, I'm looking straight ahead, and now I'm pulling my chin back. Or maybe a little exaggerated. Maybe I'm getting a little bit of a double chin. So I'm going from neutral to pulling back. Notice I'm not looking up and I'm not looking down. I'm pulling my head straight back. So that's going to help with the mobility of the spine, because the more we can get the head upright, the more all the joints can be used to turn your head and not just those top ones. So that's a big thing that we do for that. If you're already upright and you want to stretch your neck, first I'm going to caution you that we're going to do this gently, all right? I never want you doing something where you're cranking your neck. But what you can do is sit up nice and tall, look to the left, and use your hands gently to apply a little bit of extra pressure. Hold for a few seconds and then come back. Okay, you can do this at your jaw, but if that's uncomfortable, you can also do this at your temple. I'm holding for a few seconds and then I'm coming out. I might go 10 times to the left and 10 times to the right. And again, I'm not cranking into pain. I'm brushing up against the stiffness, pausing and coming out. The goal is that the stiffness recedes as we approach it. So those are two things that we can do for stiffness of the neck. If you were to come into physical therapy, you might also experience, we would do some soft tissue work if there is muscle tightness that's contributing, and a lot more guidance as far as form and performance of exercises that you can do to improve the mobility of your neck. I know I make it look easy, but a lot of folks have a lot of difficulty with pulling their neck back like that. Sometimes we help you by doing it manually first, and we manually help guide you through the motion first so that we make sure your form's correct. If you're experiencing stiffness in your neck that's really bothering you and not going away, come in to see us. We might be able to help you. We offer free consultations with the doctor of physical therapy. All you have to do is give our office a call at 215-997-9898. And if you're in the Norristown area, ask for an appointment with Cassidy. Have a great day.